So good morning once again. In the continuation with the healthcare system in India, today I am going to take the objectives and the function of the primary health centers. So as you know, the primary health centers are sometimes known as the public health centers. In our country, around 30,000 PSCs is available, out of which 24,855 located in rural areas, while 5,190 are located in the urban areas. And the role of PSC is very important as far as because it's a first level, primary level healthcare system are concerned. So it focuses on the comprehensive and interrelated aspect of the physical, mental, and the social health and the well-being. And primary health care ensures the people receive the comprehensive care ranging from the promotion and the prevention of treatment, rehabilitation, and the palliative care as close as feasible to the people's everyday environment. So they are generally situated in the public, where the public can meet easily. As per 2017 National Health Policy, they have committed for the more than 2/3 of the total resources in PSC only. And their objective is 150,000 health and wellness center. This is a new name given by the government now. These centers will provide the comprehensive healthcare covering around 70% of the outpatient care, including the non-communicable diseases and maternal and child health services. These centers will also provide the free essential drugs and diagnostic services, as well as the referral access to secondary and tertiary health system. So in this way, if we will make a strong this PSC, so there will be less burden on the secondary and tertiary healthcare system. To smooth and to standardize this system, government has given the guideline for the primary health centers under the Indian Public Health Standard, which was revised in 2012. So according to this, the primary health center is the cornerstone for the rural health services generally. So it is situated into the population of 20,000 in hilly area and 30,000 population in plain. They are divided into the two types, so type A and type B, on the basis of the deliveries are performed in these hospitals. So type A PSC, which a delivery load of less than 20 delivery in a month, and in case of more than 20, these are known as the type B. The main objective of PSCs as per the IPHS, we can say to provide the comprehensive primary health care to the community through the primary health centers to achieve and maintain an acceptable standard of quality of care, to make the services more responsive and sensitive to the need of community. These are the some objective of PSC as per the IPHS. Now, most important is the function of these PSC. So, first function is the medical care. So, to provide the medical care, OPD services, essential OPD services, a total 6 hours of the OPD services, out of which the 4 hours in the morning and 2 hours in the afternoon. So, they can cover the entire day. 24 hours emergency services they have to provide, and the referral services, inpatient services, as we know that PSC contains around 4 to 6 beds. Then number two, the most important, the maternal and child health care, including family planning. So under these, we can say the antenatal care, intranatal care, postnatal care, and the newborn and care for the child. Apart from it, to maintain the population of our country, the family welfare is also a part of primary health care system. Then medical termination of the pregnancy is also done in the PSC only, as per the MTP. Number 4, the management of the reproductive tract infection and sexually transmitted infection in these center only. The nutrition services are should be provided as per the ICD guidelines. Then diagnosis of the nutrition advice to the malnourished children, pregnant women, and the others. Diagnosis and management of anemia and vitamin A deficiency, coordination with the ICDS. So this is the fifth main function. Then sixth, in particular places where the Kala-Jar, malaria, Japanese encephalitis, and all that such type of endemic disease are prevail. So the prevention and control of the such type of diseases. In our country, we are having the so many programs related to the health. So the effective execution of the national health programs is also a part of PSC. Then number 8, the oral health essential oral health promotion and the checkups. And appropriate referral on the identification because they are not having the proper dentist in their PSC. Then referral services is again an important part. So appropriate and prompt referral to the cases needed by specialist care, including the stabilization of patient, appropriate support to the patient during the transport, providing the transport facilities. So these are the facilities we have to be from the PSC. Then number 11 is the training essential. That is the essential part for the various programs. They have to give the training to their employees. Then in each and every PSC, there should be the basic laboratory and diagnostic services, which can cover the many type of the diagnostic services, including the ECG, blood sugar, and others. Then monitoring and supervision, because the 6 sub-centers are under control of the primary health centers. So taking care of the ASHA, LVH, ANM, and all these is the major function of a medical officer, which is based on the PSC. Then functional linkage with the sub-center. So again, and it's an extension of the 13. There shall be the monthly review meeting with the PSC chaired by the medical officer and attended by all the health workers and health assistant. So this is the important function. Then the medical care cannot be completed with the drugs. So all the drugs available in the sub-center should also be available in the PSC. All the drug as per the state and union territory essential drug list shall be available. So these drugs should be available and these stocks should be maintained by the pharmacist. So for he who has health has hope, and he who has hope has everything. Thank you very much. These were I have just concluded the various role and function of the PSC. Thank you very much.